Hula, Qamea. This is Lucas. I wish I could visit, but to keep everybody as safe as possible, I've made this video for you until my next visit. Today I want to talk to you again about diabetes, the disease when your blood sugar is too high. As you may remember, diabetes is a problem of too much sugar in the body. But what exactly is sugar? Sugar is a type of carbohydrate, which is one of 3 macronutrients that make up food. The other 2 macronutrients are protein and fat. Together, carbohydrates, protein, and fat make up all food, kind of like how bricks together can build a wall. It is important to include all 3 in a balanced diet and not too much of just one. All of the sugar that can cause diabetes comes from the food that we eat. And some foods may have more sugar than other foods. Let's take a look at how much sugar or carbohydrates are in some of the foods you may eat. Notice that processed foods tend to have the most sugar. Let's look at some examples. What about fish? One fish has 0 or only 1 gram of carbohydrate. What about taro root or delo? That has 35 grams of carbohydrate. What about cassava root or tapioca? That's 60 grams of carbohydrate. And what about one whole coconut or lolo? That's 50 grams of carbohydrate. What about 1 cup of white rice? That has 50 grams of carbohydrate. What about instant noodles? Those have about 30 grams of carbohydrates. And 1 single slice of white bread has 30 grams of carbohydrate. What about 1 can of Coca-Cola? That has up to 45 grams of carbohydrate. And 1 bottle of a sports drink, like Gatorade, can have 40 grams of carbohydrate. And what about orange juice? Isn't juice healthy? Well, orange juice actually has 35 grams of carbohydrate, and many juices have a lot of carbohydrate in them. And what about Twisties? Our favorite potato chips? Those can have up to 70 grams of carbohydrate. That's a lot. The cause of diabetes is pretty complicated, but one of the biggest risk factors for diabetes is genetics, meaning if someone in your family has diabetes, then you are at higher risk of having diabetes yourself. Other risk factors for diabetes include having extra body fat and not exercising enough. Unfortunately, people from the Pacific Islands, including Fiji, have increased risk for diabetes because of genetics. This means that it's extra important for Fijians to watch out for diabetes. If a person has diabetes, then eating too many foods with a lot of sugar in it can damage their body. But why is diabetes so harmful for us? What's so bad about having high levels of sugar in our blood? Well, high blood sugar can actually cause many problems in our bodies. For example, it can damage our blood vessels, which can limit blood supply to our organs, like our brain and our stomach. High blood sugar can damage our nerves, reducing the ability of our skin to feel things. This can cause wounds that you may not feel, especially on your feet and your legs. It can damage our eyes, making our vision worse or even causing permanent blindness. High blood sugar can also make our immune systems weaker. This means that cuts and wounds can easily become infected. And sometimes this can even lead to amputation or cutting the limb off in order to stop the infection from going to the rest of the body. High blood sugar can even increase the risk of heart attack and stroke. In fact, the most common cause of death in people with diabetes is unfortunately heart attacks. And on average, people with diabetes can live up to 10 years less than people without diabetes. That's a lot of time. That's why it's so important that we not only detect diabetes, but also try our best to prevent it from ever happening. But how do I know if I have high blood sugar or diabetes? What are the signs? Well, diabetes actually might have very few signs, especially in the early stages. But here are some of the things that you should be watching out for. The first sign might be increased thirst or feeling like you have to drink more water than normal. Another sign is frequent urination or peeing, especially if you are waking up in the middle of the night to use the restroom more than once. Feeling more tired than usual, especially if you're getting the same amount of sleep, might be a sign of diabetes. Unintentional weight loss might be a sign of diabetes. And as we discussed earlier, blurry vision might be a sign of diabetes as well. Another sign of diabetes could be tingling feelings in your hands or feet, almost like there are ants walking on your skin. And another sign to be watching out for is if cuts or wounds are not healing as well as they used to. However, many people actually have no signs or symptoms of diabetes at all. They actually feel healthy, even though they have diabetes. This is why it's so important to check for high blood sugar even if you don't have signs of diabetes. The best way to know if you have diabetes is when a healthcare worker does a blood test using a small machine called a glucometer that measures the amount of sugar in your blood. Watch this clip here so you can see how a glucometer is used.
Stick the side of your finger with the lancet to get a drop of blood. Sticking the side of your finger rather than the tip hurts less. Use a different finger for each test to help prevent sore spots. You may need to gently massage or squeeze the blood out of your finger. Touch the correct part of the test strip to the drop of blood, but not your skin. The meter will display your blood sugar level on a screen.
I know that we've talked a lot about the dangers of diabetes, but the good news is that diabetes is almost entirely preventable with lifestyle modifications, such as staying at a normal body weight, eating a healthy diet, and exercising often. Eating healthy foods and exercising often is the best way to prevent diabetes. There are also medications that can be taken to help control sugar levels for people who already have diabetes. But today, we're going to focus more on lifestyle changes that can help prevent diabetes or at least slow its progression. Let's talk about diet and weight loss. Excess body fat is seen in almost all cases of diabetes in Pacific Islanders, including Fijians. This means that losing weight is a good way to help prevent diabetes. It is also important for your overall health. But losing weight can be really hard. One important method to help lose weight is to modify our diets. As we previously discussed, eating more vegetables like taro leaf, cassava, sweet potatoes, cabbage, and beans is a good way to get nutrition without getting too much sugar. And remember, these foods have less sugar compared to processed foods, and also don't cause a large spike in our blood sugars. Also, eating more white meat like fish and chicken is a great way to get protein and nutrients without too much sugar. Lastly, it's important to remember that eating less rice, noodles, and bread reduces the amount of carbohydrates we take in. It's also important to restrict or eliminate eating processed foods like chips and candy and drinks like soda and sports drinks because these foods have very large amounts of sugar without much nutritional value. Lastly, when you eat, it's also important to try to have 10 to 12 hours of fasting or not eating per day. For example, not eating at night after dinner. This can really help lose weight and prevent diabetes. Now let's talk about exercise, another way to help lose weight and prevent diabetes. Exercising is also a great way to help lose weight and improve your body's ability to process carbohydrates, which can prevent and treat diabetes. Playing sports like rugby or soccer are great choices for younger people. Swimming, riding a bike, and jogging are also great ways to exercise for people of all ages. But for anybody who may not be able to participate in these specific activities, walking is effective too. Walking for 30 minutes per day, especially after a meal, helps fight diabetes. Ideally, a longer walk in the morning before breakfast and then shorter walks after meals throughout the day is a great way to get exercise that helps your body the most. And remember, any exercise is better than no exercise. Even dancing counts. Now, I'd like to talk about foot care. If you have diabetes, it's important to look at your feet often to make sure you don't have any cuts or infections that you can't feel. A good habit is to check your feet every night before going to bed to see if you have any cuts or injuries. Also, whenever you're outside, it's important to wear good shoes with a durable, protective bottom to prevent any injury. And if you find any cuts or infections, it's important to keep them as clean as possible and then to get medical treatment as soon as possible. This is the best way to prevent any amputations. Okay, Qamea, we've reached the end. I hope you learned something about diabetes today and how to make healthy choices. Remember that diabetes is a lifelong disease, but many lifestyle changes can be effective in preventing it. Specifically, eating a balanced diet low in sugar and exercising most days of the week are effective. Thank you, take care, and I'll see you next time.